with people not taking the COVID-19 pandemic seriously. He feels many have let their guard down and is calling on everyone to be more diligent in preventing the spread of COVID-19.
As the city of Sioux Falls continues to see positive cases of COVID-19 climb, hospitalizations are also on the rise. Mayor Paul TENHAKEN says hospitals are managing, but they are busy.
I have healthcare partners that are saying, we need help. We need more to be done.
He estimates 15 to 20% of staffed beds are currently being used for COVID-19 patients. AVERA and SANFORD are implementing surge strategies to help with the increased demand, such as opening up more ICU beds.
We do need the public's help with this. There's a limit to how far we can increase. We also agree that we've got to keep as many things open, our schools, our businesses, our economy, as much as possible. Our ability to do that depends on each and every one of you, and how can you help? Masking is probably first and most important.
TENHAKEN said his administration won't call for a mask mandate in the city because he believes it isn't enforceable and will only lead to greater division among residents. However, he is calling on everyone to do their part to help stop the spread of COVID-19.
Wear a dang mask when you're indoors. We're not asking you to sign up for the draft here. We're asking you to wear a mask when you're inside and you can't distance. Social distance, take that seriously.
You'll likely see more signage encouraging mask use on billboards and social media. It's part of a joint effort between the city, SANFORD, and AVERA.
If you want to live in a state that gives you freedoms, that comes with an expectation of responsibility. And I need this region to do more right now.
TENHAKEN also said wearing a mask isn't a Republican or Democrat issue, but rather a public health issue.
The mayor is also starting a so-called Good Housekeeping Seal of Approval initiative to get business owners involved. If restaurants meet requirements such as providing hand sanitizer or requiring masks, then they'll get a badge they can display to let people know it's a safe place to dine.
Our record numbers that you're talking about are actually just reflective of the amount of testing that we're doing. We have tripled the amount of testing that we're doing in the state of South Dakota, which is why you're seeing elevated positive cases.
It's been suggested that we're seeing so much of a surge right now, mainly because we're testing more people, so if you test more people, you find more people, essentially. The answer to that is no, I think it's pretty clear. We are seeing a true increase in cases.
Dr. David Basil with AVERA says a doubling of hospitalizations in the last month is a clear indicator of a true surge in cases.
I also asked Mayor TENHAKEN about upcoming events expected to attract hundreds, if not thousands of people, like Governor Noem's Sportsman's Showcase at the Sioux Falls Convention Center this coming weekend. TENHAKEN said because there is no mandate, it's up to the venue and the organizers to take precautions to keep attendees safe. Yesterday on Twitter, Noem publicized T-shirts her political campaign is selling online that say, less COVID, more hunting.
Thanks, Angela. Some patients who recently tested positive for COVID-19 are getting some unexpected news. At this afternoon's news conference, Sanford Health responded to a question about some falsely reported tests. KELO's Dan Santella joins us now with the details. Good evening, Dan.
Hey, Don. Officials with Sanford Health say there were problems with a lab analyzer, which determines whether a test is positive or negative. The tests in question were performed a week ago, on October 11th, 12th, and 13th. Since the analyzer wasn't working right, some people may have received positive test results even when their tests were negative.
And it was actually picked up very early that we could have some erroneous results, and that is being worked through as we speak, and communication with primary care providers to identify patients if testing is still appropriate or what we need to do.
The analyzer was taken offline. Sanford says hundreds of tests may have been affected. If you are one of those patients, your care provider will let you know. We've posted a statement from Sanford under this story at KELOland.com. And coming up tonight on the Night Beat, I'm planning to bring you thoughts from the mayors of Canton and Brandon about the regional push against COVID-19.
Okay, thanks a lot, Dan. South Dakota set another COVID-19 record today. Nearly 8,400 people now have active cases of the virus. To give you some perspective, if all of those people were in the same spot, together they'd make up the 15th largest city in South Dakota. According to the state health department, 567 more tests came back positive. Hospitalizations in the state continue to hover around 300. And today, the state did not confirm any new deaths. 323 South Dakotans have the virus and died since the pandemic began. Nearly 200 more patients are also listed as recovered from the virus. Now, 2 South Dakota prisons are seeing more COVID-19 cases. The Department of Corrections website says that 152 inmates have active cases at the Mike Durfee State Prison, along with 4 staff members. The state penitentiary now has 28 inmates with active cases, along with 6 staff members.
Turning to weather, some snow here. I had a kiddo asking to build a snowman today, Adam.
Well, I took my son out